Canada's healthcare system is on life support. Canadian patients are too often being treated like a number instead of a customer. Yes, we're all customers of our healthcare system. That's what we are. We pay for it with our tax dollars. Yet the drain on government coffers seems to escalate while the service slides, and we, the customers, have no choice onto the universal healthcare monopoly that kills competition and creates inefficiency. The Montreal Economic Institute went looking for answers, solutions, observing the healthcare systems that do work. I want to show you the mini documentary that was created as a result. Apologies, folks, for the subtitles, but please read them. There are some very important numbers that all Canadians need to pay attention to.
In Switzerland, 40% of hospitals are private. All citizens have health insurance. Within the scope of its research program, the Montreal Economic Institute went to see how healthcare is delivered in that country.
Alors j'ai attendu environ un quart d'heure, 20 minutes avant de voir l'infirmier et ensuite le médecin.
Mon temps d'attente est à peu près de 20 minutes à 1 heure.
Dans notre centre d'urgence, le temps moyen pour un patient qui désire consulter est d'environ 1 heure.
Écoutez, je suis bien normal de vous parler d'un temps d'attente dans les hôpitaux en Suisse parce que ce n'est pas un sujet chez nous.
Il s'est passé juste une semaine entre ma visite au chirurgien et l'opération.
Ici, nous, s'il y a un délai d'attente de 15 jours, on aurait presque tendance à vous spéter.
Alors, quand je dois hospitaliser mes patients, en principe, dans la même journée, ils peuvent être pris. Quelquefois, on doit attendre 1 jour ou 2, mais c'est exceptionnel. Alors, c'est tout à fait possible, ça se fait régulièrement. Une partie importante des spécialistes qui travaillent avec la clinique de la source travaillent également dans le système public. Si la clinique de la source est pleine, je l'adresse à une autre clinique où je vais également suivre le patient.
Le cas le plus typique est les urgences où l'hôpital est débordé. Ils sont très contents que notre service d'urgence assume une proportion d'urgence. C'est pour ça qu'aussi on a un contrat de partenariat pour accepter toutes les urgences qui viennent chez nous.
C'est bien parce que les cliniques privées, ils donnent la possibilité de choisir où on va être hospitalisé, puis ils permettent de désengorger surtout le système public.
Alors, ça a un avantage direct évidemment pour le patient, c'est au travers de l'émulation qui peut être faite entre les instituts. C'est sûr que le privé et le public nécessairement une course de concurrence et qui est plutôt bénéfique aux patients parce que ça va plutôt élever la qualité. Si on est une société où on ne bénéficie que d'un service public, c'est clair qu'il y aura forcément des dérives parce que les choix sont politiques. Alors que dans le cadre d'un service privé, généralement on fait des choix qui correspondent aux attentes de la population.
Le background socio-économique de la patientèle ou de la clientèle qui consulte notre centre d'urgence est du tout venant. C'est une population de tous les milieux sociaux et il n'y a aucune sélection ni financière ni socio-économique des patients qui nous consultent.
Je m'appelle Anne Ratti et je suis enseignante au secondaire.
Marc Inesta, je suis vendeur dans une boutique de linge.
Louis Maillère, juriste retraité.
Métier menuisier ébéniste.
Je suis enseignante au primaire.
Je suis policier retraité.
Employé dans une entreprise de commerce d'appareils téléphoniques.
Le système de santé suisse postule le libre choix de manière générale. Il postule l'accès aux soins pour tous, la solidarité entre tous.
Et pour pouvoir assurer des soins pour tous et partout, eh bien, il faut cette collaboration entre le privé et le public. Et le secteur privé joue un rôle déterminant pour l'accès aux soins pour tous.
Does anyone believe we don't have the capacity? That we Canadians can't do that? Let me just repeat some key numbers. The Swiss prescription for health care is 40% private care to fill the cracks of the public system. And here are the results. Swiss care ranked 5th in the world. Canada, 25th. Yes, 24 countries have better care than the supposedly glorious public system that we have. How long do the Swiss wait for surgery? A week or 2. Median waiting time in Canada, 19 weeks. Emergency room visits. Patients in Switzerland go through the process in the Emerge in about an hour. Here in Canada, the average emergency room wait time for some key provinces in Canada, Quebec, 17 hours. Ontario, 11. Alberta, 11.5. I just want to ask you, why does the average Canadian continue to have this fantasy that Canadian healthcare is the best? Each time we change the state of the nation. Joining us now is Michel Kelly-Gagnon, CEO of the Montreal Economic Institute. Monsieur Gagnon, thanks very much for doing this.
Thank you for having us.
Thank you so much in behalf of everyone watching for putting this documentary together. What was it, Mr. Gagnon, that made the penny drop for you and your team at MEI that you had to put something together, not to hammer people over the head, but to enlighten them?
Yeah, well, you know, we have been doing for the last 10 years studies, you know, printed documents where we quote these statistics. So there's nothing new. But we felt that, you know, sometimes it's not so much to tell stuff to people, but to show it. And to be able to show, you know, to our fellow Canadians that ordinary Swiss people, because you saw in the documentary you just showed, there's a guy who sells, you know, clothing in a store. There's a guy who's a cell phone salesman. There's a retired policeman. These are not, you know, Top Gun rich people. These are ordinary folks. And the care they get, both in terms of the quality and the rapidness to which they have access to, is light years from what we have. And we just felt that, again, we knew these statistics, but if we were able to show it, it could have a more impact, we hope.
In terms of those organizations in Switzerland that seem not to have the power that organizations have in this country to keep the sclerosis in the system, give me a sense of what's that like. We know that in this country, the public interest groups who want to keep the system a monopoly are usually fed by public sector union money. Is the public sector union movement in Switzerland not as powerful as it is in Canada?
Clearly it's not as powerful, but what's interesting is we have nurses, unionized nurses from Quebec. And even in our documentary, there was a gentleman by the name of Serge who passed rapidly, made a commentary during the documentary. And he's a unionized, he was a unionized nurse from Quebec who went to the non-unionized environment of Switzerland. And he says, and everybody to whom we've talked, several others, say that their work conditions are much better. So, you know, I mean, so yeah, but you're right. You know, those interest groups are less powerful in Switzerland. But what's interesting is that in terms of, you know, the actual workload and the overall work environment of the employees of the Swiss healthcare system, it's actually better than the one we have here, even from that perspective.
Now, one of the reasons that our system is so expensive is because money, instead of going to the front lines, to the doctors, to the nurses, to the radiologists, to the anestheticians, and to all the people actually doing medical work, so much of the money gets sucked into that black hole of administration. I don't want to get too wonkish here. We can both wonk until the cows come home. But just give me a sense of percentage of money that goes to administration in Switzerland compared to Canada.
To be honest, I don't know the exact breakdown of that number, and it's a bit difficult to track because in our case we have the federal and the provincial, and in their case they have the federal and the canton. So while I don't know the specific statistics, what I can tell you is that the overall cost of the Swiss system is the same as Canada, 11.4% of GDP. So it's not more expensive overall. And the reality is that the important thing is to have access to competition, but also to capital investment, because many of these new equipments are capital intensive. And if you don't own your facilities, if you don't have a financial stake in it, clearly you don't have the same incentive in terms of renewing your stock of equipment. And this was very vivid in the video you saw. You know, I mean, when they do surgery, there's no more, you know, hand surgery, or almost no more.